Good day and welcome to another exciting episode of Logistics with Purpose. Kristi, how are you doing today?
I am good. I am really looking forward to today's interview. This is one of those that we've been anticipating for a while. So I know it's going to be a great conversation and everyone's going to learn a lot, including the two of us. So I'm excited to introduce Kelly Hamblin. She is an international development professional with 20 years of experience in global health, supply chains, and health systems strengthening, while also highlighting her experience at USDA and includes program design, project management, data use, and probably many other things that we're not even aware of. But currently she is the senior program officer at the Bill and Melinda Gates Foundation. So Kelly, thank you so much for your time. Thanks for joining us.
Thank you. Thanks so much for having me. Looking forward to it.
It's great to have you here. And as Kristi was saying, we've been actually trying to get this interview for a while because I don't think logistics or supply chain gets as exciting, interesting, and relevant as the job you have, right? You really must have seen it all. And we'll talk a little bit about it as we kind of conduct this interview. But thank you so much. We admire what you do and we admire the organization you represent. And so we're very thankful for you and for everyone that actually allowed us to set this up. So thanks.
Yeah, absolutely. Well, to get us started, we'll throw you some softballs. I'm going to ask you some quick questions and just respond with the first thing that comes to mind. Okay.
Yeah.
All right. What is one thing you do to stay healthy?
Oh, I walk my dog every day, at least an hour.
Wow, that's good. What's a skill you'd love to learn and why?
I've recently been trying to take pottery throwing lessons. It's such a Seattle thing to do, actually. And I just like the kind of like, you don't really have a whole lot of control over the clay. It just does its own thing, at least in my novice state, that's where it is. And I want to get a little better at that.
Very cool. And if you could travel I know you're well traveled already, but if you could travel anywhere in the world, where would you go?
I haven't really had the opportunity to explore much of Europe, actually. So maybe Spain, Portugal. I want to go somewhere where there's good food.
Good choice. And what's one book you think everyone should read?
Ministry of Future. I actually forget what the author's name is right now, but a really good book that kind of talks about if like a multilateral UN agency is representing people of the future, like how would they, like what would they, like in terms of climate or health, like how would they be representing generations and what the Earth of the future looks like. And it just really brings together policy and things that I'm passionate about in one book that's fiction.
Very cool. It sounds like it could be a docuseries as well.
We'll Google it and add it to the interview at some point
cool.
So people can read it.
Yeah.
And finally, what's one thing you're grateful for today?
Oh, I am grateful for the sunny weather in Seattle. It's so nice out right now.
Few and far between, yes.
Yeah.
Great.
Kelly, well, thank you so much. And once again, thanks for being here. Tell us a little bit more about Kelly and your background. Where were you born? Tell us a bit where you grew up. How was your childhood like? I mean, things that can then tell us how you came up to be the person you are now.
Yeah. So I was actually born not too far from here in Tacoma, Washington, but moved pretty soon after that. My dad was in the Coast Guard, and so we moved around a lot, and then spent most of my childhood in southern Louisiana, about an hour south of New Orleans on Bayou Lafourche, and really came to appreciate good food and good music while I was growing up living there. And also just like a small town. It was a very small town feel, culture, understanding people, like being there as a community for each other. And so yeah, that's where I spent most of my childhood through graduating from high school.
Very cool. Well, in my question, I'll ask you, what's a story from your early years that shaped who you are and what you do now? And in just that brief overview, I'm sure a number of things come to mind, but I'll ask you to choose just one.
Oh gosh. Well, actually, here's an example that is a little after my childhood, but certainly of the time when I was in Louisiana, actually in general, grocery stores in the 80s and 90s in very rural areas didn't have everything that we see now in grocery stores. And like salad was iceberg lettuce and maybe Creole tomatoes if it was the right time of year. And that was it. And so I just like I am constantly reminded now when I go to like my fancy city grocery store how fortunate we are that we've got like a nice variety of things. But I think in general, like the parallels that I saw in southern Louisiana and in my early career in West Africa were very, very obvious. Like, you know, I learned French in high school. And then when I went and lived in Francophone Africa, early in my career when I was a Peace Corps volunteer, I started identifying how many words that we spoke as kids that were actually French that I just thought it was slang. Like I remember like being at like a junior high dance and like we would say, oh, I've got the envie to dance. And I didn't understand at the time that envie is desire in French. I just thought it was weird kids slang. Yeah. And then same for like food. Gumbo is basically soup sauce in West Africa, and rigra in West Africa is basically jambalaya. Like there's so many parallels if you look at them and get a chance to kind of understand them.
Very cool. What a unique observation. I think probably the first time anybody has answered that question starting with a grocery store anecdote. But now I'm definitely going to be aware of that every time I go to the grocery store.
Well, and it illustrates a very important point too, right? I mean, we're so much connected than we like to believe. And there's so much talk, politics and some other areas about like the world and how segregated we are. But in fact is that we're very close.
Mm-hmm. Yes,
Louisiana
absolutely.
and West Africa, you were comparing the two, and they sounded very similar.
Yeah, the roots to jazz come a lot from West Africa as well, and jazz is such a heart of what is in New Orleans as well. So it comes up a lot.
Wow.
Kelly, you mentioned the Peace Corps briefly there on your answer. Any mentor at the early stages in your professional career that kind of told you or gave you a good advice or something that still resonates with you until today?
Oh gosh, the Peace Corps is such an incredible opportunity. You find people who are like-minded and get to go through 2 years of your life and where you're growing so much. I mean, age 22 to 24 is just such a formative time. And then to also for that time to be when you're kind of experiencing a big thing together. I'm still very close with many of the people that I was in Peace Corps with. We like that group that I trained with, there were about 40 of us, and we still have an annual newsletter that we circulate every Christmas.
Wow.
And that was more than 20 years ago. I'm actually seeing several of them tonight for dinner. Like it's just we're such a it's such a good opportunity to bring people who are like-minded together. And so that is like actually one of the things that comes to mind for me initially. And you know, some of them I was in grad school with, I was roommates with them after when I moved back to the US, like just kind of like lifelong friends forever.
Awesome. Well, thank you for sharing. So you graduated with a Bachelor of Arts in Sociology, Religious Studies, and Public Affairs from University of Denver. Can you tell us a little bit more about those years and what you were planning to do with your life and kind of like those degrees, how you were thinking all the pieces connected into the career that you end up choosing?
Yeah, you know, it's so funny. I had no idea what I wanted to do when I was in college.
I still don't.
Yeah, exactly. And I think that even by nature of having 3 different majors, I just couldn't decide. I was just taking classes that I thought were interesting. And it's funny how all 3 of those actually do really directly relate to what I do now. Even though I didn't understand that I was going to get into public health, but I sociology and religious studies are such an important aspect of understanding cultures and people and how they interact. Public affairs was, again, like, eventually I worked for the US government for 8 years. And so understanding how the government works and the details of that, I think, were also really relevant. And honestly, public health is basically sociology, understanding the spread of disease from the perspective of society, right? And so they actually all did kind of become understanding when you're traveling internationally. Religion is such a big component of culture and understanding the cultures around you. So it by no design and no forethought, honestly, it did kind of form what I do today, for sure. But my focus was just, I mean, the leap between Southern Louisiana and Denver is pretty significant. And so it was a big time of like growth and understanding different people around me. I did a study abroad in Nepal during that time too. So I got to, that was like my first exposure and traveling internationally. And I actually submitted my application to Peace Corps immediately after returning from that experience, because I was like, yep, like I think I want to do some more travel. And that was such a weird thing, right? That was such a, especially for friends and even my family back home, to see a desire to do that. That was such a foreign concept. It took a while. My parents were like, what are you gonna do? Why? It was a bit of a shift, for sure.
So your trip to Nepal, was it more about the religious side of things, the sociology, or the because it could have all of them, as you said.
All of
It was
them,
a
yes.
perfect combination, by the way, for doing what
Yeah,
you're doing
yeah.
now.
So it was through the lens of my religious studies major. And so I got to, learn
Wow.
about Buddhism and travel to a lot of different temples there, but there were lots of cultural, like intercultural programs as well, understanding what the politics of Nepal is, etc. And it was just like, it just kind of put me on the path, like understanding different people's experiences. And at the time I was placed in a school and was like teaching, like just being able to have for students, elementary school students, to hear in English being spoken by somebody where English is their first language was really helpful for them. And so it was like really rudimentary stuff. I was just reading from their textbook. But it was just like, it was the entry, for sure. It was the portal.
Anything in particular about the Nepalese culture that kind of struck you as, hey, this is great, I'm gonna implement this? I mean, everyone, at least me, and I've never been to Nepal, but I always picture Nepal as very religious driven, mindfulness, meditation, like very spiritual, if you will.
Yes.
Anything like living there that kind of like makes you think that that's
So yes, I think actually one of the weekends of that time that I was there, we did a home visit where we hiked out to one of the mountain villages and stayed there for the weekend. And like that was such a different experience for me, right? Like I remember like befriending a baby goat and was like super excited, but like carried around this baby goat for like half an afternoon. I loved it. But the guides who were bringing us out, who didn't understand very much English, and I of course didn't speak any Nepali, but they were teaching us some basic words during the time we were there. And like one of them that they taught was like firstborn, secondborn, thirdborn. And I think they kept referring to me, I can't remember what the term is, but of like the last born, because I'm a really petite person and I probably came off as very young, to be honest with you. And I kept correcting them. I was like, no, I'm the second born, like I'm the Miley. I remember that. And so it's just like fun, like dynamic interactions. That's like a joke that I feel like would have come up from home, right? And so it was very easy for me to kind of see the small town parallels regardless of where in the world you are.
Yeah.
Well, and after that, you went on to study a master's degree, health science, international public health, at the Johns Hopkins Bloomberg School of Public Health.
Yeah.
Could you tell us a little bit more about that time and how you started shifting towards health and your passion for the health field?
Yeah, so I guess so my Peace Corps experience was in West Africa in Guinea, and during that time there, I was placed at a health center, and I saw very prominently how availability of medicines impacted the services that the nurse or the doctor, he wasn't really a doctor, he's more of a nurse, but people referred to him as a doctor, could provide. And at one point, actually, the malaria prophylaxis that are often given to women at that time when they're pregnant, because they're at high risk of anemia, and malaria can kind of contribute to anemia, it was chloroquine, and they were stocked out of it for months, 6 months, maybe more than that. There was like this big initiative to encourage women to take it, and so the consumption went up. And then they hadn't planned for the resupply with the increased consumption, and so for months and months they were stocked out after that. And I just remember thinking to myself, this should not be this way. Like this is something that should be more easily addressed. And so when I was in grad school at Johns Hopkins, that was like having a focus on pharmaceuticals management and medicines availability was really what I wanted to dig into, knowing going into it that like I think my primary takeaway from that experience during Peace Corps was that my impact as a volunteer in a tiny village was very small, and what I was interested in was kind of the broader impact of strengthening systems overall. And so I kind of really wanted to see how a health system could be designed. How do the finances flow? How do we plan for buying medicines? How do we ensure that they get there at the right time, and how are they transported? Like that was the part that that kind of like really spoke to me. They had a couple of courses during that program that focused on medicines, and then after that I was like, okay, this is at the time that was I guess 2006 was when, or no, 2006 and 7 was when I was in grad school. I graduated in 2008, which was around the time that a lot of the kind of global purchasing mechanisms for global health products were being established. So the Gavi Fund for vaccines, the Global Fund, which supported HIV, malaria, and tuberculosis products. PEPFAR was established around that time as well, which is the President's Emergency Plan for AIDS Relief. And then not long after that, the President's Malaria Initiative, which those last two are both US government programs. And so I knew that those types of programs was where I wanted to work in when I graduated with that master's.
Very impressive. Wow. Well, it's clear you've been really focused for a long time on social impact and social good through volunteering. But as we talked about, you did Peace Corps. You also worked with institutions such as FEMA, back to Johns Hopkins, Bloomberg School of Public Health, UNICEF, USAID. So many organizations that we're all familiar with that are doing such great work. How did you continue to, I guess, learn on the job? What was it? You had the education at this point, now you're into getting the work experience. So what did you continue to learn? And then how did you kind of transition into learning more about supply chain?
Mm-hmm. So I started after grad school working for a company called John Snow Incorporated, which is one of the US government contractor implementers at the time who managed procurement and also kind of strengthening system design for supply chains for global health in lower middle income countries. I did that for about 3 years. That was a huge learning opportunity for me, just kind of understanding like what the programs are in global health. I worked on a team whose focus was kind of trying to bring in the intersection with how private sector supply chain industry operates, and then applying it to the context of global health in lower middle income countries. And so I very early on kind of identified that I would like to, you can see that they speak different languages. They use different words to say the same things, but they're really the same. And I was like, oh, like I see these connections. I want to be a person who can be a translator across these two worlds. And so then when I shifted over to work for USAID, the U.S. Agency for International Development, in a role in Rwanda, that was, I think, it gave me the opportunity to see kind of like the other side of things, how are funding decisions made, and what are being a direct partner to government counterparts within the government of Rwanda, and then later government counterparts in Tanzania, where I was for 4 years after that. And so a lot of that, like understanding deeply what their day-to-day challenges are, being counterparts with the head of a central medical store, the primary purchaser and distributor of medicines for a government. And in places like Rwanda and Tanzania, their system is quite different from how it's set up in the United States, for example. It's a more of a socialized program where everything is kind of purchased through the public sector. There's much smaller private sector services for healthcare, and so the government system for purchasing is a big has big purchasing power, and so working with them to think through what their day-to-day challenges are. They don't have enough trucks to distribute their product, or they don't have money to put gas in the trucks, or the place where everything is being stored isn't air conditioned, and so it's not like at the right temperature, like kind of basic challenges. And then also navigating, frankly, a very complicated donor ecosystem, knowing that I was contributing to that as an employee of one of the big donors, right? And so that was really formative, just like understanding the true challenges on a day-to-day that they were dealing with, but also just like from a pure skill set from in supply chain and distribution. I spent a lot of time, like I said, wanting to be able to be that translator, and so I became APIC certified. Later on, while I was in Tanzania, I did the MicroMasters through MIT. They have a MicroMasters program in supply chain. And so I did that while I was in Tanzania remotely. And I think that was, again, like the intention there is I wanted to see how the private sector industry were kind of addressing similar challenges. I think one of my big points that I'd like to make, and my takeaway in some of those additional studies, is that many of the challenges that we have in lower middle income countries were not special snowflakes. It's actually the same challenges, like coordinating across a multi-stakeholder environment might be a bit unique. Like I said, many donors, which is complicated, or purchasers, but deciding what your demand and supply plan should be, that's universal, right? And the ambiguity around that, and feeling like you have insufficient data, or that the data quality are not good, those are common regardless where you are. And so I feel like having the groundwork and understanding that, our problems and our challenges that we're working in these ecosystems, yeah, there's a different spin on it, but we're not, it's not separate from what we're seeing in the rest of the industry. So we can draw from those tools. We don't have to reinvent the wheel. We don't have to come up with our own solutions for these.
Well, Kelly, being at the other end of that kind of spectrum, right? Because we see logistics, at least the people that are here sitting in the US, when we ship things to these other countries, and especially to Africa. But being at the other end, and actually being in Tanzania or Rwanda, as you said, I mean, some of these challenges that you mentioned, I mean, they must be very tough to make a supply chain more efficient and effective. Is there, do you see any change? Has it been improving? What is the main thing when you're trying to ship into the middle of Africa, when they don't have ports and you have to go through different countries? Because that then adds up a completely different complexity to the equation.
Yeah, it does. So I think there's a couple of points. The first is that visibility is really hard. Understanding at the last mile what consumption is in a rural clinic that doesn't have cell phone connection, and might have a vehicle go out there once a month, or maybe even it's the expectation that somebody in the hardest environments hop on a bike and once a month go and pick up their supply for their next months or quarter of services. Like, it's really hard then to know when you're in a capital city or when you're a purchaser based in Washington, D.C. or in Geneva, how to plan for that, right? And so the throughput of information is much, much slower. And you end up having to make decisions in either an absence of information or with very stale information. And I think because of funding constraints, we've often designed our distribution systems and our supply chain with the funding constraints first of this is what we can do with this. So like and that might mean we would make a delivery once a quarter, right? Which actually increases pretty significantly the amount of stock you have to have on hand at a given time. Your holding costs are really high. But so I think actually accelerating the throughput of information and accelerating the throughput of product could actually bring those costs down. But even just having enough, like I was saying earlier, gas in the car to go back and forth once a month instead of once a quarter felt like a constraint. So certainly differences. I think everything, funding streams, when you're working for a government, budget comes once a year, right? And so you decide how much you're going to buy right then when that money comes in, and then you're kind of held to that because there's probably not going to be another disbursement that year. And sometimes that money, especially in the public sector, for like say the government of Tanzania or Rwanda, there's no guarantee that money will come at the right time. And so the minute it comes in, you want to spend it right away because there's no, and so that actually kind of contributes to inefficient behaviors where we're actually purchasing, you have short-term purchasing decisions, right? You can't do long-term contracts because you don't know if you're actually going to have, if you would like to outsource, for example, that you'll have enough money to fund the outsourced distribution partner next quarter. And so it makes some of the decisions inefficient and our systems inefficient in an environment that's funding constrained. And so I think those are challenges that we haven't solved yet. And it's like the funding aspect, I think is what is the next big element of what global health supply chain, I think, is going to have to solve. We spent a lot of work the last 20 years kind of working with suppliers to make demand for them more stable and kind of consolidating that purchasing power, like I was saying, Global Fund and Gavi do. And so we've done a lot of work there, but we haven't really, because most of those products are donated, we haven't looked at the funding structure as much, at least for those lower level areas. And so, and especially for products that the donors aren't buying, but that domestic governments are buying, those public sector, like bought by a Ministry of Health or the Ministry of Finance within a government. And so that's where I feel like there's more work to be done for sure.
Mm-hmm.
Wow, that was incredibly interesting, right? And you mentioned, just to summarize a few of your takeaways, you mentioned 4 in particular: visibility, really hard. Information is not readily available, and there's a lot of constraints around that. And working with different governments and their budgeting processes and decision making, and then on top of all that, not having enough funding. So, guessing it was like an incredible masterclass on supply chain while you were in those countries, and you probably learned a lot more than you did during your time at school.
Oh, absolutely. I feel like
just looking firsthand.
Learning by doing, for sure. That's where it was. And then also learning from, so many people who had come before me, my government counterparts who had been there for many, many years before I was there, for sure.
You're an incredible caring person as well. So I have to ask you, how frustrating is it? Because you see that, because we're talking about medicines, right? Because at the end of the day, on one hand, you're there living with them, and you know that if you don't deliver this on time, people were going to die. This is not, you're not delivering furniture, right?
Yeah.
People will end up dying. And then how do you cope with the kind of mental, emotional stress? Because that, for me, is something very, very brave and makes you a very special person just for that in particular.
Oh, well, thanks. I am like my employer, an impatient optimist, I would say. I think
I
that
like
can be
that.
done better. I think, and I am passionate about trying to see it get done better. I look at how this ecosystem works and am energized by where there is opportunity, and that's what keeps me going, I say. But it can sometimes be frustrating, for sure. Like, I feel like it feels like there's very basic things that could be done better that aren't done better. And I think part of the challenge is understanding what the root cause is and why they are the way they are. Because there's no, like, there's a lot of funds going to this program, these programs. And so all the easy stuff to fix have been fixed. And so it's really, we're working with really tough problems these days.
Absolutely. Well, thanks again. So let's jump to the Bill and Melinda Gates Foundation, which is your current employer and an incredible organization, very, I guess, renowned. A lot of people know about it, at least the names, right? Founded by Bill Gates and Melinda Gates in 1994. You joined in 2018. And before we kind of like dive a little more into what you do on a daily basis, which I'm sure it's incredibly interesting, for our listeners and some of the people out there that may know the organization and may know the names, but that's pretty much all they know. What do they really do? What is the Bill and Melinda Gates Foundation?
Yeah, so I think the foundation was started and founded with a kind of like a strong belief that all lives have equal value, right? That's like kind of like our starting point. And I think in the early days, especially looking at vaccines, where I think that's the team that I work on. I work on the immunization team. 20, nearly 25 years ago, both Bill and Melinda were seeing an ecosystem where there were new and improved vaccines that were very commonly used in kind of Western countries and just were not available in lower middle income countries yet. They were more expensive. They're extremely effective at preventing under 5 mortality, and it just felt completely unfair to them that people who were equally as deserving were not getting access to these vaccines. And so a lot of what we do, and the Gates Foundation now has kind of like, it doesn't just do health, although that is quite a bit of the work that we do, but has expanded to equal access to education, good food and nutrition and agricultural programs. And so there's a lot of what the foundation kind of gets into, kind of access to digital services, like financial services, for example. And so there's, but the kind of like the grounding principle is that all lives have equal value, and we should see some of these like best tools that feel kind of like normal and accessible to anyone, to us, should also be accessible to them.
Well, focusing on the optimism side of the impatient optimism for a second, can you tell us about, that is a great term that we will certainly use. Can you tell us about some of the big accomplishments that have been, that have come to life through the work there, because they're pretty remarkable?
Oh, yes. Sure. So I guess the foundation works quite closely with a lot of global partners. So being instrumental in founding Gavi, the Global Alliance for Vaccine Initiative, and the Global Fund. Like I said earlier, they procure malaria, tuberculosis, and HIV products. They've been instrumental in some of those programs, kind of shaping them. Have strong partnerships with the WHO, the World Health Organization, and UNICEF, and kind of other global partners. Also strong partnerships in the development of new products. I think one thing that I'm quite pleased about is recently is kind of identifying where there could be a small change that could have really big impact. So there is a vaccine for HPV, which had previously only been available with the guidance that it needed to be multiple doses, like 2 or 3 doses in order to be effective. And so we funded a researcher to understand better whether it could be an effective vaccine with just a single dose. And there's no incentive for the pharmaceutical industry, for example, to do that research, right? Like that would require doing additional clinical trials. They've already got a product that's approved. And so kind of supporting research like that, so that then with just one dose, it's that vaccine is available at a much lower cost, right? Like, and that's that makes it more accessible to countries that are funding constrained. And so those are the types of roles that we can play, where we can identify where there's no incentive. There might be a market failure that would make the ecosystem more efficient, but there's no incentive structure to address it, like pooling the purchasing altogether of vaccines or HIV products, for example. So that's really the type of role that we play, is look at the market overall as an ecosystem and identify where there might be failures, and that an intervention from an organization like us could help to resolve it.
And am I recalling correctly from my tour there years ago that the Gates Foundation was also at least partly responsible for wiping out like polio or something? I mean, what did you do today?
Yeah. So we're very close. Polio isn't quite
Okay.
eradicated yet, but there's a few small pockets globally that are remaining. But the global polio eradication program is they're in the final stretch, I would say. And most of the places where polio continues to exist right now are in really difficult environments, and that might have conflict or are fragile states, or places that it's just hard to reach people with the vaccine. And so a lot of what the foundation, the Gates Foundation, does now is kind of helping to support the greater reach for those places that are just like very, very hard to access.
Yeah, it's amazing. Well, you are, as we mentioned, the Senior Program Officer. You lead and manage global supply chain activities on vaccine, integrated delivery systems. Let's talk about one of the big issues that we've all experienced in the last few years, the COVID pandemic. There were challenges everywhere. Vaccines were on, that was a word we all said every day at that time. So what kind of challenges were you guys trying to figure out? Like, how do we solve this, and how do we solve this quickly? Because there are major things happening across the world right now.
Yeah. Well, first of all, I think one of the things that COVID-19 did for me personally is finally my family and friends understand what it is I do on a day-to-day, because supply chain for medicines was like what everybody was talking about. And so suddenly what I did was relevant and important. And so, yeah, I mean, of course, that was a challenging time for everyone. I mean, of course, and the role of myself at the foundation is really to be a supporter and a cheerleader of a lot of the other organizations that do all of the hard work. Gavi, who is a purchaser of vaccines, including for COVID vaccines. UNICEF is as the procurement agent, and the World Health Organization is providing guidance. And so I was kind of partnering with many of them, thinking through like what will this look like? And before the vaccines were even developed, when we were beginning to get an indication that the first vaccines to become available were going to require a temperature profile that's not commonly available in lower middle income countries, and at -70 degrees. Honestly, there was just such dismay from all of us, because it just felt inaccessible. It felt like, here's another example of a tool that would be in our toolbox that was going to be more available to the US and to Europe than it would be to many people who lived in sub-Saharan Africa. And there was just like initially this feeling of futility, like, oh, like we'll just have to wait longer for a vaccine that we can use. And I think that our stance at the foundation was, no, it's not, we don't just wait. We got to find a way to remove those problems. Like, let's talk about what they are, and like remove as many barriers as we can, so it at least can be an option. And so then began my crash course in what it's like to establish a cold chain at -70 degrees, and geographies that have an ambient temperature as high as 43 Celsius, right?
Wow.
And so big temperature span there, and often they don't have consistent power supply. The transportation is really challenging. I think one of my favorite conversations during that time was talking to an organization that's called Project Last Mile in partnership with the Coca-Cola Foundation, where we just started exploring, well, we've got all this CO2 for soda, and how can that be converted to dry ice? Can we make dry ice? Like, we know that Coca-Cola is available all over sub-Saharan Africa. So can we use that available CO2 to get dry ice? And so they did an analysis where we pulled together like where in West Africa, where in Southern Africa there was enough. Could we set up some partnerships to make that dry ice and distribute it? And that actually resulted in some partnerships in Southern Africa in partnership with Project Last Mile to help with the distribution of the COVID vaccine there. So, and it also, I think, even just having those conversations and doing that landscape removed the veil of futility. Like, oh, okay, like this could be a product that we can consider for lower and middle income countries and for sub-Saharan Africa. And so then like we started talking about other options. Well, maybe we can bring ultra cold, like ultra low temperature freezers and place them in centralized locations. And so suddenly there's freezers going out to capital cities, and the good news is, as long as those freezers continue to work, they could be, now they're pre-positioned. Like if there's another pandemic and we have another like sudden need for a vaccine for a pandemic, they're there, and hopefully we'll be able to kind of continue to use them until then. So it's really pre-positioned. So that was, I think, a lot of my day-to-day in thinking about cold chain for immunization is actually looking at that -2 to -8. It's a much easier temperature profile. And even that is very limited. I think we often will design our immunization programs around where the cold chain can reach. And so most of the time I'm trying to get like just a refrigerator or a freezer that can freeze ice so that we can put that ice in a carrier and then walk out to a rural village to ensure that immunization services can go. But even that part is hard. But to show us that it was possible to respond to a pandemic with a less temperature stable vaccine when absolutely needed, I think that kind of, it was very inspiring for me. I really, it was a hard time. And to at least
Wow.
like prove that we could get something there, I think was really monumental.
It sounds unbelievable. At least it's one of the coolest, most interesting cases I've heard in the last couple of years,
Yeah.
for sure. Like setting up a cold chain in sub-Saharan Africa with temperatures of over 100
Right.
Fahrenheit.
Yep.
And this
Innovation
was
in a hurry.
collaboration, right? A lot of collaboration. You reached out. You mentioned the Coca-Cola Foundation. You mentioned Project Last Mile. It's unbelievable.
Yeah.
And
I mean,
congratulations to everyone.
all of what I did during that time, and I feel like I worked the least compared to many of those colleagues that I was working with. Like I said, I was primarily just a cheerleader in that time, but it allowed me to kind of see the landscape higher and identify where those connections could be made, right? Like everyone else was really in the weeds, like trying to do the like operational challenges. And I think that's one of the benefits of being in the role that I'm in at the Gates Foundation, is to kind of identify where there are opportunities across organizations that haven't been identified.
Yeah. Wow.
Well, we'll mention this at the end of the interview, but if anyone's listening and it's equally inspired and excited as we are right now, and if you know or have connections, you have to step forward and share them, because this kind of collaboration save lives, and there's still a lot of work to be done, and we can't do it by ourselves. It has to be a joint effort by all the countries in the world. So again, we'll say this again at the end, but I just want to make sure, like a quick comment for everyone that's listening. Everyone's help adds up, right? So everyone can do something,
Absolutely.
even if it's little.
Yeah.
So
Absolutely. Yes, I will also look at Coke in a whole new way. If you can get a Coke there, why
I
can't you
know,
get
that's
a
great.
Yeah. And you can always reuse the fridge later. Well, obviously we've seen so many advancements, many of which you just touched on for cold chain, supply chain visibility, which is also important in remote areas, design efficiency, reliability, and delivery. What are a couple of things that have really, I guess, touched on your work more that you have been a part of or that you have witnessed that has made your life a lot easier?
I think for me, it's supply chain visibility. I see, like I said earlier, so much opportunity for our systems to be more efficient. In the absence of that information, we end up having to just flood the market and the ecosystem with as much product as possible, right? Because we don't have the agility, because we don't have the visibility. So I think if we could have a stronger understanding of what is where and what consumption is, then we would really be able to kind of like make our systems much leaner, or holding costs lower. I'm very energized right now with the opportunity of that are provided by kind of global standards to facilitate interoperability. So in the healthcare industry, having a global standard for barcodes, GS1 barcodes, to do automated data capture, that kind of also having those global standards facilitates a very fragmented digital ecosystem that where products are handed off multiple times over. I mean, the ecosystem is quite complicated. You've got a funder who is different from a purchaser, who is different from who owns the product, who is different from who distributes the product. And often within a country, it gets handed off between a Ministry of Health and a Ministry of Local Government, and then the local health system multiple times over as well. And so each of them have their own digital solutions, and being able to allow us to use the same code to refer to a product as it passes through that system is hugely powerful. And we're not there yet. And like, we're not there yet, even in many Western digital solutions. So I'm not going to critique it, but I do think that there's a lot of power there, and the not having that, I think, is what's kind of preventing us from being more efficient. So that's what gives me energy. I think there's a lot of opportunity there. And like I said, like, our systems are so bulky. The feeling is that we need to have stock held at a national level, and then a regional level, and then a district level, and then at a health facility in the absence of that information. So that's where I think there's power in that visibility.
Wow. AI, I'm guessing it's going to help a little bit, or that's some of the problems that I think AI is going to try to tackle and help us with. Are you guys already doing some things with AI?
Absolutely. Actually, the foundation has a whole task team on AI and what the opportunities are there. I think even just like being able to use your phone to do an automated data capture by taking a picture of a product, and not actually needing that standard code. So there's interesting power there that I think we would like to explore further and are beginning to explore. Having serialized product is the environments that we work in have the regulatory systems are still growing, right? And so being able to ensure that product is not falsified is a big aspect of why we think that those global standards are important. And we can't get that. So we can identify what a product is, but it might be challenging to identify whether it's been authenticated or not until we have that serialized number. And so there's like, it can solve part of the problem. And I think we're really excited about that, because right now we're not solving most of it.
It sounds like a very, very challenging problem to solve and very complex, but I'm sure that I'm sure you guys will crack it, and it's going to be helping a lot of people again. So thanks again to you and to your entire team, because as you mentioned, there's tons and tons of people working on things like this to make a difference in the life, I guess, people in poorer countries.
Yeah.
So One of the things I want to talk to you about, and changing gears a bit, is the Sustainable Development Goals. I know that the foundation's guided by these principles, and I know that it's primarily focusing on a few of them, right? To improving vaccination rates, advancing women's economic power, assisting those living in areas with high diseases and poverty burdens. There's so many things that you can help with, right? There's so many areas that need support. How do you keep like a focus on things that are actually going to have not only the most impact, but then how do you say no to some things that might be very beneficial, but at the same time you can't do everything. So
Yeah.
how do you guide you and your team and all the efforts of the foundation through what's more important to do and what comes first, what comes later?
Yeah, that's such a good question. I think almost always we have more appetite than we have ability to
Right.
work on all of the potential areas that we could work on. The Gates Foundation is very data driven. I think we have there are so many, I'm surrounded by so many smart people, and looking at what impact is likely to be through modeled impact, just even understanding limiting the conversation just to immunization programs, looking at the various different pipeline products of new vaccines that are going to come to market over the course of the next, say, 10 years, and then deciding, well, which of those belong in a program that could be supported through a pooled purchasing program and a donation program like that. Like, looking at what the modeled impact is of the number of lives saved can help to inform that based off of the cost, and then of course like factoring in what the cost is there. And that's why I spoke earlier about the HPV vaccine. That one is such an interesting one because it's actually modeling the potential lives saved, but not for children under 5, but for women who would suffer from cervical cancer later in life, right? And so it has like a huge potential impact in terms of lives saved, but it's later in life, and so it might have been like harder to identify. And so we use kind of exercises like modeling to really understand what that potential impact is. But I would also add, taking a completely, like, of course, there's like very smart people who are running models on computers, but there's also a lot of humans out there to talk to as well, right? And especially referring to the Sustainable Development Goals, the Gates Foundation has a program called Goalkeepers, which like brings young people in to kind of hold us all accountable to those Sustainable Development Goals, and hear from them as representatives of civil society, of humans in the world who are impacted by these Sustainable Development Goals, and ensure that their voice is heard when global policy is being set. And I love that program. I think it's such an important aspect of what the foundation does, so that it's not just about the science, and also includes the human.
Fantastic. I love that. Goalkeepers. That's great. Exciting. And you're clearly very passionate about what you do. It comes across and makes us excited too. Well, there's also a great series of clips on your website called Partner of Potential, Human Potential. Talks about the different parts of the foundation, and even your partners. And as we talked about earlier, one of the reasons that we think logistics is so important is because it is part of everything we all do every day, whether you realize it or not.
Mm-hmm.
You've mentioned some of your amazing partners that you work with. How do you keep your team, your partners, everybody working on the same goals? What does that connectivity look like, and how are you all focused on making an impact together?
Oh yeah, that's such a great question, and probably a thing that we could do better. But I think the foundation works very closely with global funding facilities like Gavi and Global Fund, and we see them as the lead in what the like direct implementation is for for implementation for immunization programs for Gavi, and then Global Fund for others, the Global Financing Facility, which is a part of the World Bank as well, which provides financing for critical health elements as well. We also, one of the things that I've been a part of is aligning with other global funders in supply chain specifically. So there's a group called the Interagency Supply Group and the Funders Forum that's associated with that, so that we as donors can talk to each other and coordinate, like who's paying for like an upgrade to the digital system and Ghana, and where do we all align on like what the global standards are and where we should be focusing our attention in interoperability and global traceability kind of like data architecture. And I think that that's I first of all, I love talking to my colleagues and peers in that way and collaborating with them. But we're so much more powerful and effective when we're talking together rather than kind of like each kind of doing our own thing in silos. And so that's, I think, one of the ways that we do it. And having that interagency supply group kind of come together, it's a community of practice, bringing together governments and academics and multilateral organizations and these implementers like JSI, which I spoke about earlier, and other organizations that we either support or partner with, like PATH or Village Reach, the Clinton Health Access Initiative. There's a bunch of organizations out there. And so that coordination point that you mentioned is so critical because there's a lot of players who are trying to contribute. And ensuring that we're all talking to each other is, like, I think, one of the most important things so that we can be good partners to the countries that we're intending to support.
Fantastic. We need to see more of that.
For sure. And again, it's a great website for anyone that is interested in learning a little bit more about what you do. And just actually, even if you don't want to learn more of what you do, but you just want to be inspired so you can keep doing whatever else you're doing, you should definitely watch some of these clips. Yeah. Regarding nonprofit logistics, what are one or two changes that you'd like to see across the board?
I think multi-stakeholder collaboration is an area that we could do better in. So I talked about, like, even just coordinating, like what, like some of our interoperability, or like who's helping a country update their information systems. But when we're talking about supply planning or demand planning, having a clear understanding of who's supporting what, when that shipment is coming, kind of aligning across that. It's hard enough when you're just one organization, but when you've got multiple funders for products contributing to one country, making sure you're really well aligned is critical. And then when you don't have quite enough warehouse space, it's not just about making sure you don't stock out, but you also need to make sure that you don't overwhelm the customs clearance official or the warehouse. And so there's, when you're shipping 1 quarter's worth of vaccines to one location in Nigeria, for example, that could take up a whole warehouse, right? The volume that we're talking about is huge. Yeah. So I think having that multi-stakeholder coordination, especially for demand and supply planning, is an area that I think we could be doing better. And especially because of the handoffs, like I said, it's the funder and the purchaser and the procurement agent and the distributor. Those are all different players. And so it adds complexity. And we don't have, like industry does, a bottom line to align to that kind of brings everybody together. We have a shared objective of the number of lives that we want to save. And so, but the ways that we can get there might differ. They might vary, right?
Makes sense. And do you know of, is there software out there that kind of trying to bridge this gap, or is there like some GPS tracking available to follow up shipments more closely? I mean, is there some things that are already in the market? I know there's still not enough, but
yeah, so there's a couple of examples. So I think my favorite example is the Global Family Planning Visibility and Analytics Network, the Global FPVAN, which is implemented by the Reproductive Health Supplies Coalition, and they bring together UNFPA and USAID, the U.S. Agency for International Development, who are some of the bigger purchasers for contraceptives and family planning products, and allow them to coordinate with each other, but then also they're partnering with manufacturers so that the manufacturers can get some of that visibility. And they use E2Open as their tool for implementing that. And have also even been able to make that available to each of the countries that are kind of benefiting from that coordination, right? So shipments that are destined for each of those countries have access to the system. They can identify when, for example, it would look at when shipments would come and like what their stock on hand is and identify whether that is coming at the right time or whether we need to adjust the timing of that shipment. But it's not fully automated. There's still some aspects of it that are kind of like manual, like identifying rules by exception. So identify where there might be something that we need to kind of have a conversation about, and then we can talk about it. But it really allows them to focus that conversation where where it needs to be.
Makes sense. Well, now talking about the Bill and Melinda Gates Foundation, what the next 5 years, like let's move on to the broader picture here. Look into your crystal ball. Where do you think the future is going to take us? And I know that it's a pretty difficult question to ask, given everything that's been happening in the world.
Yeah.
But what are the future plans? What's going like the vision? What's some of the things that you think are going to happen in the next 5 to 10 years?
Oh man, gosh. Well, hopefully we will be much closer to or have already eradicated polio. I think that's like a big thing that I would hope to have been able to say by then. Which would then, I think, allow us to kind of move on and tackle the next big challenge, right? I think that there is still, we're going to have a number of new products coming in to development that are in the pipeline. I think a tuberculosis vaccine is something that probably is a little further out than 5 years, but we would be talking about it in a more real way at that point, which just tuberculosis is such a critical infectious disease that we haven't had new development in such a very long time. And it's a centuries old infectious disease and has just not gotten enough attention. And so really would like to see that. There's also a malaria vaccine that is already available with limited distribution. Right now, it's still the full course, because it requires multiple doses, is actually quite expensive. And so making it more financially accessible over time, maybe additional products would come to market that are more cost effective. So those are the types of things that I think from a just like product availability, what tools are in our toolbox. When I look at kind of like procurement and distribution, I think I would hope that we have a system with more visibility and that we're more agile and responsive, that we would have the ability to adjust more proactively, using kind of predictive analytics to identify when we're off course early on so that we can adjust. Making it easier for our suppliers and manufacturers to give them that visibility earlier on. And then a more vertically integrated supply chain so that suppliers can have better access to what consumption is at the country level. How's that for ambition?
Thank you so much. Well, that is incredibly exciting. No, I'll say it's exciting, and it's kind of like in line with what you guys are capable of doing. And we're here to help you out. And by we, I mean not only my company, but like everyone that's listening to you. I think we're all kind of like on the same boat here when I say that we want more people to survive, for sure. We want more people to be alive. We want to improve the conditions of people living in other countries, and we definitely want to continue leveraging technology and smart people to make a positive impact in the world. So thank you so much. This has been a very exciting interview. So thank you so much. And again, thank you for everything that you guys are doing and the team at the Bill and Melinda Gates Foundation are doing, because you deserve all the credit and all the applause and all the accolades that you can get, because you're really making this a better world.
Yeah. Oh, thank you. And thank you for having me.
Yes, absolutely. I know. I feel like I learned so much and I should receive ongoing education credits for participating in this conversation.
No,
Feel so much more well-informed. So
Well,
thank
as you can see, I get very excited about this. I'll
Yes.
talk for a really long time if you put me on a topic. So
No, it's great. This was much better than sitting through a lecture. So thank you. This was terrific. Well, and as we wrap up, of course, hopefully people will want to reach out either to learn more, to partner, to somehow be involved in helping pursue the every person has value concept. So how do people connect with you and learn more about the Bill and Melinda Gates Foundation?
Oh, absolutely. Well, I think the any of the social media platforms you would learn more about the foundation overall. On LinkedIn, you can find me. My name is Kelly Hamblin. Always eager to hear from people, and in particular, I would add a specific call out for anyone actually in some of the emerging markets that we work in lower middle income countries. I'm always eager to hear from people who are either working in private industry and wanting to contribute to what the public health sector is, or who are already in that public health sector and are looking to connect and learn. I'm here for sure.
Okay.
Well, thank you once again. We'll put like the link to all the things that you have said
Yep.
and some of the clips as well, so that people can follow you more closely. And again, and if people out there listening to us, if you like conversations like the one we just had with Kelly and the Bill and Melinda Gates Foundation, please don't forget to subscribe, and I'll see you on the next episode of Logistics with Purpose. Thank you so much.